Kita tunggu 5 minit lagi ya. Okay, we can start now, I think. Okay, since we have around 21 participants today, so so we are going to proceed with our talk today lah. Okay, so but before that, Assalamualaikum and a very good afternoon to everyone, and welcome back to our first Journal Club program for this year in 2022. I hope that all of you are able to get some input from our program throughout this year, and I'm very glad to have all of you today. Okay, but before that, as for your information, our what we call this one, High PG Mate is actually a rebranding from our previous talk, which is before this we name it as WhatsApp World. Okay, so this year we rebrand into High PG Mate so that it will be very informal and we can participate with all of our postgraduate students. Okay, so right before we proceed with our talk, let me introduce to you to our speaker. For today, we have Nashrulhaq Tagiling. Okay, he is actually from Tawau, Sabah, and currently he is studying in PhD in nuclear medicine in School of Medicine, right? Okay, so his supervisor is actually Dr. Norazlina, and currently she is with us also today. Okay, and for your information, Nashrul is actually one of our alumni in PPSK, and he is studying masters uh, in in medical radiation from 2017 until 2019, right? Nashrul? Yeah, okay. So, so before I will give this talk to Nashrul. I will pass the baton to him to present about gastrointestinal, sorry, gastric motility disorder. What medical physicists need to know. Okay. So, Nashrul, you can start now.
All right, thank you, Atika, for the kind introduction. Let me share my slides first. All right, can you guys see? Is it on the presenter slide or the main slide?
Currently not in full screen.
Oh, okay. Let me just wait. Yeah. Okay. Is it okay now?
Yes, okay.
All right. Okay, sorry for the technical error just now. So I would like to say thanks again to Atika and Husna actually for inviting me to give this talk on my PhD study. So for today's presentation, I'll try to deliver as lay as possible so that the public and also non-experts in this field would know what is gastric motility and what is gastric motility disorders. So basically the title is actually not accurate because initially I was intending to present this as a way of promoting gastric motility studies towards medical physicists, but since the postgraduate students in PPSK, PPSG, or PPSP are not medical physicists, so I'll just present this as a way to introduce to you guys what is gastric motility. So the stomach in general is a hollow muscular organ that roughly looks like a crescent shape, or some would say a mango shape. As you can see in the pictures on the right hand side, there are different shapes of stomach that has been radiologically determined. So for example, the first shape is a steer horn that looks like a crescent, or some might say like a mango. And another one is cascade, which is also looks like a mango, or you can say like a it can become slim like an hourglass, and then it starts to go back and expand or dilate. So these shapes could be determined by many factors. For example, the amount of stomach contents. So stomach contents is including the gastric juice, the food, the digestion stage, which we will explore further in the slides. And also the neighboring organs could also determine the shape of the stomach, the body type, whether they are slim or fat. Females and males may have different types of stomach shapes, and also the age. So we move forward. Okay, so the anatomy of the stomach. So I typically, the anatomy is divided into 5 parts, but I narrow it down to 4. So for the first part is called the cardia. So the cardia is where the cardiac sphincter or the lower esophageal sphincter is located. So this acts like a door to prevent your food from spilling out from the stomach once it already enters the stomach. And then the next is the fundus, which is this dome-shaped anatomical region on the top of the stomach. And then the body. So the body is the biggest part of the stomach. As you can see here, it is identified by the lesser or greater curvature. When I mention the lesser curvature, it means that this part, the smallest curve in the angulation of the stomach organ, whereby the greater curvature is the larger part of the body that curves around. So maybe someone can say this is like a concave or convex. Either way, it can be described as such. And then last but not least, the end of the stomach is known as the pyloric antrum. Actually, this is a two-part, the pylorus and the antrum, but typically some people also describe it as the pyloric antrum. So this region is identified by the cone-shaped structure that marks the end of the stomach, and it's very thick. The muscles around here are very thick, and the pyloric sphincter is located here. So this is the pyloric sphincter, which marks the end of the stomach before it goes down to the small intestine, starting from the duodenum. All right. So what is gastric motility? Some people might be confused, like, is it mortality? Is it motility? So this term is actually not very common, especially among the public. So motility is basically the process whereby food travels through the digestive tract via peristalsis. So if you guys remember during your school days, you might learn what is peristalsis, which is basically how the muscles within the digestive tract pushes food throughout the entire intestines and so on. So when we talk about gastric motility, we are talking specifically about the peristaltic movement within the stomach organ. So different gastric regions have different function and motility mechanisms, which I will show next. All right. So the first component of the gastric motility is called the gastric accommodation, or the storing function. So for this particular motility mechanism, it will involve the fundus and the body, or typically the doctors will say this is as the proximal stomach, So it consists of receptive and adaptive relaxation of the proximal stomach. As you can see in the image shown here, the first one is an image of a barium video fluoroscopy, whereby someone ingested a barium milk, and then the milk goes down to the stomach. As you can see there, there's a stomach organ there. And then when we talk about gastric accommodation, it involves two parts. So when we start to open our mouths and chewing or swallowing food, the stomach already dilates or expands autonomically. Automatically, the stomach will expand to allow food to be entered into the stomach. So this is what we call as the receptive relaxation of the proximal stomach. But when the food already reaches to the stomach will enters this adaptive relaxation, meaning you will be still eating, but the stomach is already expanded. So this part we call as adaptive. So typically, normal accommodation response produce minimal to no rise in stomach pressure and is typically not perceived. When we say about typically not perceived, meaning that anyone will not experience how the stomach expands. So this is what we call as gastric accommodation or the storing function of the stomach. Next. Next is the retroperistaltic phase, or typically known as retropropulsion phase. So this phase is also called as the mixing function. To describe this particular motility, it is frequent and sustained peristaltic contraction that travels from the body, which is the mid part of the stomach, to the pyloric antrum. So this motion from the body to the pyloric sphincter is called propulsion. However, when food is not properly digested or the food doesn't reach certain size that allows them to be expelled to the duodenum, the peristaltic wave is reflected back by the pyloric sphincter back to the body, back to the body part. So it's like retro. Retro means kembali atau terbalik. So dia dah maju and then dia akan kembali ke bahagian body. So this one is we call retropulsion. This mixing process is repeated for so many times to produce a thick semi-fluid mass called chyme. So chyme is basically the mixture of your gastric acid, the enzymes, the food, and the drink that you had during your meal. I hope everyone can follow. All right, we go on to the last part, which is gastric emptying. So gastric emptying occurs at the pyloric antrum region or the distal stomach. So this type of gastric motility, we can say that the periodic contractions and retropulsion breaks down food to around 0.5 to 2 millimeters, allowing chyme to be emptied easily. So this is another picture of video fluoroscopy. So as you can see, the antrum pushes the food to the pyloric sphincter and it escapes to the duodenum. So this is what we call as the gastric emptying. So how is this being done? The thick antral muscles pushes the chyme to the pyloric sphincter and emptying it to the duodenum in a controlled manner. So every peristaltic wave will, or propulsion peristaltic wave, will empty around 1 milliliter of chyme. So someone might ask, why only 1 milliliter per propulsion peristaltic wave? Because the duodenum is not designed to receive gastric acid. So it needs to control all the amount of gastric acid from the food before it enters to the duodenum so that the duodenum is not damaged by the gastric acid or the chyme. All right? Okay, another question. Does an empty stomach move? So the answer is yes. It is controlled by this phenomenon called migrating motor complex. So migrating motor complex is a motility phenomenon that is a combination of stomach muscles inactivity followed by a series of peristaltic contractions and recurs every 1 to 5 to 2 hours. So typically when there's no food inside the stomach will basically will be in an inactive state for around 1 hour before a wave of peristaltic contractions occur. So this peristaltic contraction functions as the housekeeping mechanism to the gastrointestinal tract. So what the MMC or the migrating motor complex do is to clear the stomach of mucus, bacteria, exfoliated cells, and also undigested materials. All right. So since I've explained what is gastric motility, we may now look into gastric motility disorders. So there are two types of gastric motility disorders. The first one we call as gastroparesis. So gastroparesis is defined as the partial paralysis of stomach muscle, which causes abnormal emptying in the absence of mechanical obstruction. Meaning tak ada apa-apa halangan dekat pyloric sphincter. When you see the healthy stomach here, the food travels from the esophagus into the stomach and it experiences the normal motility phenomenon that I have explained before, and then it will be emptied slowly into the duodenum. However, in patients with gastroparesis, the vagus nerve or the vagal nerve is known to be damaged. Is thought to be damaged. Okay, sorry. Is thought to be damaged. So when it is damaged, it cannot properly empties the food within the stomach into the small intestine. So what does this cause? It may cause certain symptoms such as nausea and also bloating. And in severe cases, it may cause dehydration, it may cause malnutrition, growth of bacteria within the stomach, and also this thing called bezoars. So bezoars I already showed here. This is like a undigested food that has been building up within the stomach. So when you have problems with your stomach organ due to the vagal nerve being damaged, food cannot properly empty the duodenum and it will stay within the stomach and build up like a cavity gigi lah, something like that lah. Dia akan jadi bulat-bulat benda macam ni. If you want to see the images, you can look in Google. So gastroparesis is basically mostly people say like the exact cause is unknown, but we hypothesize that the vagal nerve is being damaged. So what diseases can cause the vagal nerve to have damages? So there are two main reasons why the vagal nerve might be affected. So the first one is diabetes, and the second one is idiopathic. So we don't know why the patient have a problem with the gastric emptying. So typically they will experience postprandial fullness, which is very discomfort, and then nausea, vomiting, early satiety or cepat kenyang, and bloating, kembung perut. Other reasons that may cause damage to the vagal nerve includes the intake of medications such as narcotics or antidepressants, post-surgery, for example, bariatric surgery, or any other surgery within the abdominal region, post-gastroenteritis or jangkitan virus di kawasan perut, neurologic diseases such as Parkinson's, and also connective tissue diseases such as scleroderma. All these can cause damage to the vagal nerve that might affect your gastric motility, hence causing all this discomfort throughout your life. And usually, this is a long life symptoms. There are currently no treatments, but there are certain drugs that can be used by doctors in order to alleviate these symptoms. So we move forward to functional dyspepsia. So dyspepsia is basically is basically a Greek word. So this means bad, pepsia means digestion. So it's like a bad digestion or indigestion. So functional dyspepsia is a collection of upper GI complaints. For example, fullness after meal, stomach pain and burning in the absence of organic causes. When I say organic causes, it means that the doctor have investigated everything, dah buat endoskopi tapi di dalam tak jumpa ulcer, we don't find any polyp or cancer. And then we also do many tests, but everything turned out to be normal, but you still experience such symptoms. So this is what we call, or we group them as functional dyspepsia. And functional dyspepsia can be divided into two subgroups. So the first one is on here, which is called postprandial distress syndrome. And the next one is epigastric pain syndrome. So there's a very detailed criteria on how you want to diagnose patients with PDS or EPS. But just to sum it up, PDS typically presents with discomfort after eating a regular size meal. So basically, contoh you biasa makan nasi goreng satu pinggan, and then you rasa sangat discomfort dekat kawasan perut. Enam to your navel, your pusat. So that region is we call as the stomach region. Whereas early satiety means you makan sedikit je, you dah rasa kenyang macam makan a standard meal. So that's why I show here like 2 spoons. You eat 2 spoons of the nasi goreng and you already feel full. So this is what we call as postprandial distress syndrome. So the diagnosis, usually you need to experience these symptoms at least 3 times a week for the past 6 months. Then only we can group you as a functional dyspepsia. If not, that's probably something else. All right. Whereas epigastric pain, this is not related to the meal at all. So the experiences might be epigastric pain, or usually I describe this as sakit yang mencucuk, or epigastric burning, or sakit yang terbakar. So it's two different types of pain, but it is grouped as epigastric pain. All right. All right. What is the possible cause for functional dyspepsia symptoms? There are many. Similar to gastroparesis, is actually very complex and relatively unknown, but there are many hypotheses on as to why these symptoms might occur. So the first symptoms might be the first reason might be disturbances in the gastric sensory motor function. For example, an impaired accommodation or delayed emptying. Second is hypersensitivity to gastric distension. So meaning your stomach is extra sensitive when it's being filled by food. Third is immune dysfunction. For example, excess in immune cells such as mast cells. Psychosocial factors is also known to be a contributor towards this functional dyspepsia symptoms. For example, if you experience stress, anxiety, you experience psychological trauma, for example, like divorce or kerugian wang ke, and depression, it could also lead to functional dyspepsia. And also dietary intake. There's actually a research in Malaysia saying that people who eat spicy food is more likely to develop functional dyspepsia compared to those who did not. So when they did the research, so they say that Malay and Indians are more likely to develop functional dyspepsia compared to Chinese, probably because Malays like to eat spicy and the Indians like to eat curries or spices, whereas the Chinese, they're not really into those sorts of food. Other types of food triggers may also include oily food and also coffee. Okay, so how can medical physicists help gastroenterologists? So the way they will help gastroenterologists is through imaging modalities and techniques. This is the specialty of medical physicists. They have specialty in maths and physical science and also statistics. So let's look at the first technique of imaging, which is called the barium video fluoroscopy. So this procedure involves the drinking of barium milk or a barium meal. And then this barium is radio opaque, so you can see it clearly in the X-ray here. So the advantage of this technique is it observes good anatomical detail. For example, you can see here, since gas is not present in X-ray, so it presents like a black area here. So we can determine that. And the barium coats the entire lining of the stomach. So you can differentiate the anatomical regions within the stomach, for example, the body and also the duodenum. This is the pyloric sphincter. So when you do a video, this is an example of a video fluoroscopy whereby the patient drinks the barium milk and it is recorded in a video form. So other advantages is it's easily to perform and widely available. This is technically available everywhere that has a radiology department, and you just need to snap the picture or the video and you're done. However, there are many disadvantages. First one, it's a non-physiologic meal. Although barium is safe to ingest, but it is not physiological. It's not something that you eat or you can simulate. You cannot simulate gastric motility by using barium because it's not something that is commonly drink by humans. All right. And then it's also user dependent. So the interpretation is relatively depends on the doctors. It is also more suitable for esophageal motility, meaning you want to see the peristaltic movement within the esophagus instead of the stomach, because the stomach might take a longer time to empty compared to the esophagus. And last but not least, it requires high radiation to produce reliable images or videos of gastric motility. So you imagine that you need to, if you want to assess gastric motility, which might take around 2 to 4 hours. So it's not appropriate for the doctors or anyone who is in the radiology department to bombard the patient with radiation because it's not safe. So sometimes this is only reserved for esophageal motility. The next one is gastric emptying scintigraphy. So gastric emptying scintigraphy is currently the gold standard or the number one method to measure gastric emptying. So it involves a physiologic meal, which is an egg white sandwich. So as you can see in this picture here, this is me injecting the radioactive material directly into the egg whites. So the special thing about this technique is that the radioactive material only wants to adhere to white eggs only. So during preparation, you cannot have any remnants of yellow egg within the white egg. So that's why if you see at the back of this picture, we purchase bottles of white eggs in order to eliminate such issues to occur, because the radioactive material would not label perfectly with the meal. Once it is being injected, we mix it thoroughly and we cook it in a scrambled egg form. So as you can see in this picture below, looks delicious, right? So some patients, I've heard some accounts that it tastes normal. Some people say it tastes fishy. There's this one patient who described it very weirdly. They say it tastes like durian. So I don't know. Maybe there's something wrong with her taste buds or anything. But generally speaking, people say it just tastes normal. So we serve this egg whites with 2 slices of bread, and then two scoops of strawberry jam and chili sauce for taste. So why do we choose this specific meal? Because this meal is developed in the Western. So when they want to assess gastric emptying, they want to simulate the gastric emptying during breakfast. So this is a typical Western breakfast meal. So we serve this to the volunteers or to the patients, and then we require them to finish the entire meal, including 1 cup of water, within 10 minutes. So, okay. Another advantage is that it is low radiation dose. So the effective dose is around 0.8 to 1.2 millisievert. So it's a very low dose and it's very safe. It is lower than chest X-ray, and the interpretation is easy to calculate, and doctors and anyone can easily interpret. So basically, how we do interpret these images. So this is the images produced from the gastric emptying scintigraphy. We took imaging for 4 hours. So there are 6 imaging time points. At 0 hour, immediately after you finish eating, you can see like this region of light, it like lights up. So this is basically the time or the sandwich that you ate. All right. And then it will slowly goes down to the small intestines and so on. So a normal imaging scan would be described as the radioactive count within this region of interest to be less than 10%. So if anything that is above 10% during the 4-hour imaging time point, we will categorize you as abnormal. So abnormality could be many reasons. It could be like due to the wrong preparation of food, or who knows, some centers might put planta, which increases the fat content within the eggs. So when you put a lot of fat within the eggs, it is known that fat will empty slower compared to carbohydrates and any other food components. So it could be due to that. It could also be due to um, many other reasons. But for in this case, is to diagnose gastroparesis and functional dyspepsia. So the disadvantages of this scanning procedure is that it may not be suitable for those who have egg allergies or vegetarians because they don't eat eggs. It's a lengthy procedure. It's a 4-hour imaging, but actually one imaging time point is actually 1 minute only, but it will take so long because it requires you to complete the 4-hour period. Like I said, it's frequently done incorrectly. Some centers even give rice. Some centers give chocolate cake. It varies between places to places, but the currently accepted gold standard is this Western breakfast. And last but not least, the disadvantages is limited availability because not all centers have nuclear medicine centers. Next is another nuclear medicine imaging, which is called single photon emission CT or SPECT. So in this case, the patient is injected with radioactive material as opposed to ingesting the radioactive material. So the radioactive material will preferentially go to the stomach and cover the stomach mucosa. So as you can see, this pink region here is actually the stomach mucosa. So from the stomach mucosa, you can 3D design it to shape like a stomach. So this is a data set from mine. So you can see here, this is a 3D image of the fasting stomach, and this is the 3D image after ingesting 250 ml of nutrient drink. So the function of this imaging technique is to measure the volume of the stomach and also to measure the accommodation motility. Another advantage, it uses a physiologic meal, which is a nutrient drink as opposed to barium. Can be used in fasting and fat state. As you can see here, we can see the stomach shape on fasting and also after meal. And it has been validated in several nuclear labs. However, there's also disadvantages. First, if you want to do like a combination of accommodation and emptying scan, it requires dual isotope or 2 types of radiation material. So the first one you need to inject and the other one you need to ingest. Another one is radioactive uptake varies greatly. So it varies from person to person. So some person might not have mucosa at the end of their stomach at the pyloric region, or some might not have great uptake at the fundic region. It is also labor intensive for image analysis, and similar to the gastric emptying, it is limited. So just to let you guys know that in East Coast region of Peninsula Malaysia, only HUSM got a nuclear medicine center. All right. The next one is interesting. This is magnetic resonance imaging. So magnetic resonance imaging is very known for its non-ionizing radiation advantage. So there is no damage to the healthy cells within your body. So this technique we can use to measure the volume and also different motility patterns. So as you can see in this GIF image here, this is showing the propulsion of the stomach and also the retropulsion. So you can see here, this is from a company named Motilan. So their software is very tailored to measure each of the stomach regions points in order for us to see the contractions. And on top of here is an image from my study. This is a static MRI. So as you can see, we can use static MRI to quantify volume, but dynamic MRI we can use to assess motility pattern. So similar to the previous studies in nuclear medicine, it is also using physiologic meal, preferably nutrient ring or any soup. And another advantage is that it produces high resolution soft tissue image and video. However, this imaging technique is very expensive, both ordering and software. Might not suitable for those who have claustrophobia and those who have metal implants such as braces or any metal implants within their body. It is also requiring a labor-intensive image analysis and limited availability. Next is abdominal ultrasound. So abdominal ultrasound is known for being cheap. So this is the cheapest modality that you can use to assess gastric motility. So typically people use abdominal ultrasound to measure accommodation and emptying. It is also a non-ionizing radiation modality, and it uses a physiologic meal. So the physiologic meal is assorted. You can use anything. However, it might be difficult to assess emptying using solid foods when you want to try to assess the motility. And it is highly user dependent. So typically only doctors operate this imaging modality. From what I know, no physicists, physicists or anyone, technologists can learn the anatomy, but it will be very difficult unless you learn from A to Z. And then obesity and bowel gas might affect the imaging. It might disturb the images produced by the abdominal ultrasound. And last but not least, the stomach geometry is assumed. So meaning you cannot really get an exact shape of the stomach. So as you can see in this pink 3D image render from the abdominal ultrasound, it doesn't really look like, it has like a somewhat of a stomach shape, but you need to assume, unlike the other imaging modalities, you can already quickly get the stomach shape. So that would be a hindrance when using abdominal ultrasound. Okay, so just briefly, I'm just going to describe my ongoing research in USM. So my current PhD is I'm assessing the gastric sensory motor function between healthy people and also functional dyspepsia patients. So this is also somewhat like a recruitment poster for anyone who's interested. So my first study is the mechanistic role of neuromodulators on gastric sensory motor function. So without going into details, because I do not, I prefer those who are interested in joining my study to contact me personally so that I can describe it to them in a more personal way, because sometimes my words can get construed when it's online. So neuromodulators are basically antidepressants. So we want to use antidepressants to see whether there are changes in the stomach function, or how do they affect the sensation while you are having your meal. So for this study, I would like to invite anyone, any Malaysians who are currently residing in Kelantan, regardless of students or any public members, aged 18 to 65 years old, with a normal BMI from 18.5 up to the overweight of 29.9. So in this study, we still consider overweight as normal. However, obese, we might not be able to recruit you guys. And most importantly, no history of chronic medical and psychiatric illnesses and past abdominal surgeries. All right. So part of the pilot study has been presented last year in August at the Asian Pacific Digestive Week. So these are the findings from the imaging, and also another modality that I did not describe here because it's not related to medical physics. It's more related to biophysics or biomedical, which is manometry. So just to show you guys, this is a pressure plot from manometry. So from here, we can, well, although you see like there's nothing really changes between the fasting, feeding, and after meal state, but actually this manometry catheter is very sensitive in detecting pressure changes within the stomach. So the graph here shows that during fasting, it's relatively stable. However, during the nutrient drink challenge, it starts to drop, showing that the stomach relaxes in order to accept food within the stomach. And once the volunteers stop drinking, it starts to recover back. So this is the interesting part of my PhD study. So we are doing a multi-modality study on assessing the gastric sensory motor function. It's actually more detailed than this. However, I cannot disclose everything within this sharing session. All right. And then the next one, I have another clinical study. So this is just like a side project. So this research is funded by the Malaysian Society of Gastroenterology and Hepatology. So we just got the funding last year. As opposed to the first one, the first study, we got the funding in 2020 from FRGS. So this one is a private funding. So this study is called gastric emptying scintigraphy using Abbott Vital Nutrient Drink. So the criteria to join this study is Malaysians only residing in Kelantan, preferably, age 18 to 65 years old, with a normal to overweight BMI, no history of chronic medical and psychiatric illnesses and past abdominal surgery. And currently, I'm only looking for males and non-Bumiputra volunteers. So guys, if you are interested in joining, you can just scan the QR code to approach me personally. Sorry, ladies, I cannot accept ladies anymore because I have too many ladies in this research. So for this research, we will provide 100 ringgit honorarium after completing 2 scan visits. All right. Okay, the study has also been published. The abstract has also been published in Journal of Gastroenterology and Hepatology last year. So this is just like our pilot findings before we publish the real data set after the end of the entire trial. So we compare egg white sandwich and Vital. So some people might ask, what is Vital and why do you compare it with the egg white? So there's a very good study in United States in 2013 and 2019, whereby they use this very high caloric meal, which is called Ensure Plus. But in Malaysia, we don't have Ensure Plus. We only have Vital. So it's like actually a sibling, like almost the similar food content, the drink, but it's intended for different people. So Ensure Plus is targeted to the public, whereas Vital is targeted to those who have indigestion problems. So when we run the analysis, when we compare the egg white sandwich with the Vital, as you can see, it empties at the similar rate. So actually, Vital is actually a very good candidate to replace the egg white sandwich because first, it's standardized because it comes from the kilang. So you just have to inject the radioactive material into the milk, and then you can just drink it. And then secondly, it's halal, it's kosher free, and it's suitable for vegetarian. So those who are having vegetarian issues and even lactose intolerant issues, you can drink this milk. So we can increase the pool of reference levels for healthy volunteers in the future when we do this trial. So currently, for this trial, I'm not so sure how many more left that I need, but maybe around 5 to 10 more volunteers. But like I said, I only recruit males and a non-Bumiputra. If you are a non-Bumiputra but female, sure, you can come. But if you're but if you're a Bumiputra female, sorry, I cannot include you in the study. All right. So as a summary, gastric motility is the peristaltic movement within the stomach and comprises of migrating motor complex during the empty stomach and accommodation, retropulsion, and emptying during the digestion phase. So common gastric motility disorders are gastroparesis and functional dyspepsia. The reasons as to why this occur is largely unknown, but there are certain hypotheses on why these motility disorders occur. And most gastric sensory motor function tests remain as a research tool. I forgot to tell everyone that all the imaging modalities that I've presented to you guys, except for gastric emptying, is actually a research tool. We do not yet have a good database for assessing motility because it may vary from regions. So someone from Africa might not have the same motility pattern as to someone from Asia. So the main objective from my study is to collect for the Malaysian population. However, it's an expensive test, so we can only recruit a few people. But we're planning to recruit more in the future, maybe after PhD or my supervisor interested to get another grant. So yeah, this gastric sensory motor function test will definitely help doctors in diagnosis and in diagnosing these motility disorders, come to a conclusion and may offer treatment to them because currently there's no treatment available for diseases, only to alleviate symptoms. So I would like to say thank you everyone for listening. Yeah, thank you.
Okay, Nashrul. But before that, we have some question in the chat box. Can you see it?
Yes, I am trying to look for it. Mana? Oh, okay. So the first question is, so if we drink Yakult or Vitagen, is the drinks can help us to overcome this disorder? Um, this is more related to the gut microbiome, right? So my research team also investigates about gut microbiome, but not specifically towards these motility diseases. But from my reading, I did read certain prebiotics, probiotics can definitely help to alleviate the symptoms, but not necessarily treat the disease. So, in order for you, for example, if you have functional dyspepsia, you might need to consult with a gastroenterologist in order to get a proper opinion as to whether drinking probiotics or these prebiotics will help to reduce all those symptoms. The next question is from Wan Nurul Shafawani. In your opinion, MRI is the best imaging technology to provide details evaluation of gastroparesis in patients. In terms of safety, cost, and risk, macam mana? Okay. Like I said, MRI is a very good technique because it is currently the most detailed imaging for soft tissue. So since the stomach is a soft tissue, it's very perfect to measure to quantify the volume and also assess the motility. Safety, um, it is relatively safe. Actually, pregnant women can also do MRI, but certain centers might not be able to certain centers might not be able to accommodate to pregnant women because they are afraid that something might happen at the MRI, right? And then for cost, it's expensive. I can tell you, the cost for a non-contrasted MRI in HUSM for the abdominal region would cost you around 650 ringgit. It's quite expensive, and that is for orang awam B40. But if you are T20, the price goes higher. 1,050 ringgit, something like that, 1,200 ringgit. So it's a very expensive. It's a very expensive scan to order. So this is actually the dilemma that happened to gastroenterologists, because when they want to order MRI for gastric motility assessment, radiologists are not many radiologists are not interested in investigating the abdominal region because of the complexity of it. So yeah, some people might not just do MRI. Plus, like I said before, MRI technique for gastrointestinal motility is still within the research phase and might require more time in the future for it to be properly developed. And about the risk, I think it's similar to safety. It's relatively safe. Okay, from Nurul, you mentioned that Malays and Indians are the most to have this disorder. In terms of gender, are there any differences? Yes, I want to correct you. Actually, not, I mean, Malays and Indians are more susceptible to have functional dyspepsia because they tend to eat spicy food. But that doesn't necessarily mean Malays and Indians are the ones that are the most to have this disorder, because the prevalence of this disease, both gastroparesis and functional dyspepsia in Malaysia, is poorly investigated. There are currently no statistics on them. So yeah, so we need to actually the global data for functional dyspepsia is with us. So my co-supervisor, Prof. Lee, is actually the main investigator for this country. So actually, we are planning to do a research paper on that, but not in the immediate time. So maybe in the future, if we have published the paper, we will share that to you. And in terms of gender, yes, females are more likely to get gastroparesis and functional dyspepsia compared to males. I'm not so sure about the ratio, but I think it's 4-1. So females are 4 times more likely to develop gastroparesis and functional dyspepsia compared to males. Okay, from Amira Jamil, my former colleague, kenapa buat study ni dengan spec? So spec tu sebab kenapa guna spec? Kita guna spec sebab satu, in HUSM, nuclear medicine department is not as busy as radiology. So that one, plus it's cheaper. I think it's cheaper to perform spec imaging for the stomach as compared to MRI. Like I said, I think if you perform spec imaging, it will cost you around 100 ringgit per scan. So it's like almost like 6 times GMAT lah compared to MRI. So yeah, and then for gastric emptying, it depends on the radiopharmaceutical use juga. So for example, we published this study 2 years ago. We compared this very expensive radiopharmaceutical, which is called sulfur colloid, and we compare it to sodium phytate, and we found that sodium phytate produces a comparable gastric emptying pattern among the same individual. So the cost of sulfur colloid is 6,000 ringgit per 5 vials, whereas sodium phytate is around 600 ringgit per 5 vials. So it really depends. Kalau dekat HUSM, it depends dengan unit taksiran, dia nak charge you harga sulfur colloid ataupun harga sodium phytate. And then the same question, another question from Amira is, apakah fungsi antidepresan dalam study ni? Okay, antidepressant, I don't want to get into too much detail, Tapi the function of antidepressant here is to alleviate the symptoms. Sebab memang patient-patient yang ada functional dyspepsia ni, mereka datang dengan comorbidity of masalah-masalah psychosocial factors tu lah, like I said, depression, anxiety, psychological trauma, yang boleh menyebabkan simptom-simptom yang dialami tu semakin lebih teruk. So, kita guna antidepressant ni as a way to alleviate the symptoms. Tapi bila kajian cakap there's an alleviation of symptoms, we do not know what happened actually. Is it like the central nervous system yang affected, ataupun there's something changing within the stomach? So that is the main the main part of my study is to we want to investigate whether these antidepressants are actually changing the stomach itself as compared to just alleviating symptoms. All right. And then Nur Atika mana? Nur Atika Syahira Syari. Ada option substitute lain tak selain egg whites? Okay, like I said before, different center guna different meal. Walaupun internationally, kita kena follow satu je, which is egg white sandwich. Tapi there are certain centers around the world that propose a different meal to suit the culture. For example, di Thailand, negara jiran kita ni, mereka tak guna sandwich, mereka guna nasi. So nasi tu dorang inject dengan nasi putih tu, dorang inject dengan bahan radioaktif and serve to patient. And then kajian daripada mereka dapat yang bahawa nasi dengan sandwich tu empties at the similar rate. Macam itulah. Ada study ada guna oatmeal, oat porridge, and then our current study we are using the vital milk. So we are looking for all these substitutes and options. Kenapa? Sebab we want to help those patients who cannot eat eggs, because there are a subgroup of patients who might not be able to eat eggs because of religion ke, culture ke, or maybe orang ada allergy. Okay, Amira Jamil cakap, okay, spek jimat guna radiation. Kiranya study ni guna MRI dan spek saja. Yes, for my study, I only do 2 imaging modalities, spek and MRI. I did not do any conventional radiological assessment macam barium. Tapi we also do endoscopy. Endoscopy is actually an imaging jugalah. You want to investigate the internal lining of your stomach. Tapi that one is not operated by medical physicists, those are operated by gastroenterologists. And then, okay, from Husna, the person who invited me, thank you. It's actually good because like if you join this study, you can actually get a free diagnosis of your stomach. Who knows what's underlying within your stomach kan? I don't want to mention any names, but sometimes kan, you complain, you cakap normal je. You did not experience any symptoms or anything. But when we do the workup using endoscopy, you can actually find interesting things, underlying diseases inside your esophagus and also your stomach. So anyone who's interested in joining this study, it's actually good for you. It's a good experience to know more about your stomach and how to eat more properly lah. Okay. And then untuk Muhammad Nazir, how strong is the brain gut axis? Psychology is said to affect digestive function. Do you screen for mental health? Yes. When they okay, this study is also related to brain gut axis, tapi I don't want to go into it sebab I think the discussion would be too detailed. But yes, we did screen using hospital anxiety and depression questionnaire, HADS. So just do a typical screening, like asking about the quality of life. In fact, like there's another questionnaire that we also use, which is called the SFNDI. It's like a combination of quality of life, mental health, and also your gastrointestinal symptoms. So it encompasses everything. So whenever any people who join my study, syarat dia kena lepas dulu screening lah. So this one you cannot lie to me. If you lie to me, I can know. Because when we do all those investigations, you will certainly know, because this is a very long study. I need your full cooperation. So eventually, if you lie to me, everything will be exposed lah, something like that. I think no more question from the audience. Okay.
Okay, so there is no more questions. So we can proceed to Kahoot quiz. Okay, so for Kahoot session, we are going to have 5 questions, and the first winner will be given a present. Okay, so wait for a while. I will share with you the PIN number of Kahoot. Can everyone see? Can we start, everyone? Okay, so now let's start. Okay, so nampaknya ada yang 4 orang yang betul. Okay, so next we go to the next question. Okay, double F, the first one. Okay, so lagi dua lagi seorang tak jawab. Okay. So the right answer is migrating motor complex. Okay, so we will see who will be the first one. Wow, siapa ni? NFMH. Okay. Congrats. Okay, badan ni baru je nombor 2. Okay, so we proceed to next question. Okay, now let's see who got the first one. Wow, Nurul. Okay, so congrats. So we proceed to the next question. Okay, so we will see. Okay, Nurul still the first one. Okay, next. Oh, okay. All right, so the correct answer is positron emission tomography. So only one who got correct. Okay, so we'll see who we got the first one. Okay, so that one. The first one goes to. Okay, thank you, Nurul. So after this, please claim your present with me. Okay. Congrats to the winners. Okay. Okay, so I think that's all for today. Nashrul, do you have anything to add on?
I just want to say thank you again to the organizing committee, especially Atika and Husna for approaching me to present this research. It's been a great pleasure. Also, as an alumni of PPSK, I'm very proud to present this research to you guys. So if you guys are interested, I would very love to get in touch with you guys. The honorarium is quite a lot. I don't want to mention it actually, tapi if you guys are interested, you can get money and also at the same time get a free screening on your stomach health and also at the same time increasing your knowledge on the stomach organ. It's a very interesting organ for everyone to learn. Thank you so much.
Okay, all right. So thank you, Nashrul, for giving a talk today. So I think that's all for today. So thank you very much to all the participants for today. And I hope that you'll get much input for today's talk. Okay. So see you next time and see you again in another program for Journal Club program. Bye-bye.
Bye everyone.